Hi, I'm Dan Blackman with Durham and Dale's Clinical Psychology. And today I'm going to be addressing another frequently asked question, which is what's the difference between a clinical psychologist and other mental health professionals? I'm going to cover clinical psychologists, counseling psychologists, psychiatrists, psychoanalysts, psychotherapists, cognitive behavioral therapists, and counselors. So, a clinical psychologist has completed a first degree in psychology and a government funded NHS based doctorate. The fact that our doctorate is government funded makes it a very competitive process, with only around 15 to 16% of applicants managing to secure a place. Our training covers the full lifespan, and we specialise in psychological assessment and therapy, typically cognitive behavioural therapy, and at least one other approach. So, my training also covered cognitive analytic therapy, psychodynamic psychotherapy, and systemic psychotherapy. We're specialists in research and evaluation, and our statutory regulation is undertaken by the Healthcare Professions Council, who are a national body that oversees standards within our training and also within our professional behaviour. Our professional body is the British Psychological Society, who represent us. Our closest cousins are counselling psychologists who've also completed a degree in psychology, and they also undertake a doctoral level training. However, it's self funded and the placements aren't necessarily undertaken within the NHS. They focus principally upon working age adults and the specialist application of psychological therapies. Counselling psychologists are required to undergo some personal therapy as part of their training, and they're regulated and professionally represented in the same way as clinical psychologists. A psychiatrist has a first degree in medicine, and then they undertake a 3-year postgraduate vocational specialization in psychiatry. They're specialists in diagnosing mental health conditions, prescribing medication, and overseeing procedures such as electroconvulsive therapy. They undertake the majority of statutory duties like sectioning, and as medical doctors are regulated by the General Medical Council. Professionally, they're represented by the Royal College of Psychiatrists. The psychoanalyst usually will have a first degree in a relevant subject, and the main component of their training is a personal analysis, which will take place around about 5 days a week for a number of years until a training committee is satisfied that the training is complete. Typically, they practice in practice, but they may also deliver psychoanalytic psychotherapy in the NHS. Psychoanalysts often offer supervision and teaching to other professionals. There's no statutory regulating body, and professionally, they're represented by the British Psychoanalytic Council. Psychotherapists are represented by a range of bodies, including the UK Council for Psychotherapy, British Association for Counselling and Psychotherapy, and the British Psychoanalytic Council. In order to access a course accredited by one of these bodies, a person would need an existing qualification in a related discipline, such as nursing or social work or counselling, and or a relevant first degree. Usually the period of personal therapy is also required to access a training course. Many psychotherapists work in independent practice. There's no statutory regulation, and the professional bodies are as shown on this slide. A cognitive behavioral therapist typically is qualified in a related discipline like nursing or occupational therapy, and they might have a first degree in a related subject with adequate work experience instead of having to be fully qualified in a related discipline. If they satisfy those entry requirements, they will access a postgraduate diploma, which is 2 years, which will qualify them to provide CBT in a specialist manner to adults, typically with depression and or an anxiety disorder. Sometimes a broader range of difficulties will be treated, but this depends largely on the service within which the CBT therapist would work. There's no statutory regulation for CBT therapists, and professionally, they're represented by the BABCP. Finally, a counsellor will complete a level 5 diploma, which is equivalent to a foundation degree for recognition by the UKCP or BACP. Typically, they provide support to individuals with mental health problems of mild, moderate severity, and often are involved in helping people with difficulties in adjusting to changes in their life. Again, there's no statutory regulation, and they're represented professionally by the UKCP and BACP. Okay, so that covers all of the groups that I wanted to give you an overview of. I'm Dan Blackman with Durham and Dale's Clinical Psychology, www.ddcp.co.uk.